For this year conference, I choose, of course, anatomy. But I have to say, for this presentation, I was inspired a little bit by my recent visit in the UK when I was teaching level 4. And I was talking to my students about anatomy, showing them some pictures from the dissections. And I had the feeling that they really did enjoy that they were curious to see what they are doing, where they are doing, what structures they are addressing. So I thought, why not to create a presentation about the anatomy of the basic body balance? Or look how many layers are on the move when you are performing the equine touch. And of course, we will start with the cheat card from level 1. And I just would like to say something about that. We have arrows there, which are representing the ET moves, and we are placing them sort of on the horse's body like you see it on the muscles. But it's not what you are touching. The muscles are the last layer, but before that you have to touch at least 2 or 3 another layers. And to really start from the top, we have to speak about the skin very briefly because I had many presentations about the skin. Skin is the largest organ with many important receptors in it. And what is interesting that those receptors, they can actually understand your ET or ET move because they speak a language of the physics. And we create tensile forces, we're applying a pressure, we're moving the structures to the side. So yes, they do understand. And for you to actually see what you are doing, let me dissect a little bit our move. We represent, or we show the move as an arrow with a little dot on the end. And we are placing the arrow on the top of the muscles. This drawing represents our muscles, some nice muscle with a nice round belly, some fusiform muscle, like for example biceps or rhomboid. And we place the arrow crossing the muscle fibers. So ET move is cross fiber move. When you see the orange dot, it is the place where we apply a pressure. It is very usual behind that muscle. If we look at here, this would be once again our muscle on the cross section, and we have the orange and yellow, orange and green, but we have to start with the first part of the move, and that is the blue arrow that is not on our charts. That arrow represents the skin slack. When you pick up the skin with sort of very light pressure, just only to glue your thumbs to the skin, not to the hair, but to the skin, and then you pull the skin, you stretch the skin over the muscle, trying to reach the curved edge. This is very important, as you will see on next pictures, because with the skin, you are addressing another superficial layers, very important ones. So, after the skin slack, when you reach the edge of the muscle, you will apply the pressure. That is the orange dot on your cheat card. That pressure should be behind that muscle, sometimes in the grooves, but sometimes it is actually on the muscle, especially when we are working on flat muscles that you cannot feel those curves. But let's go back to this fusiform muscle. So, pulling skin back over the muscle, behind the muscle, we will stop and slowly we will apply the pressure, going through some superficial layers behind the muscle, and after our waiting period, the challenge, 2, 3, just a couple of seconds, we will with the same pressure go against the muscle. So first we are pushing against the muscle. We will slightly deform the muscle when you're pushing it from its own space, so you're mobilizing that muscle within its surrounding. And then the muscle cannot stretch any further, so it will jump back, it will recoil underneath your fingers into the original position. sending some vibration through its lens and origin and insertion. So then you are working with the muscles. But I really would like to start a little bit here, so you know that after the skin, which is your first organ to touch, we need to go underneath the skin to see what is there. And I have here two pictures which are basically we are looking underneath the skin. And what is different is this layer of the tissue connecting the skin to the deep body. Here we have skin and skin muscle. Connection between these two structures is quite tight, and we can see it that there is not very thick layer of that loose connection which would allow movement. We can see individual collagen fibers, but as I said, it's quite tight connection because this muscle is moving the skin. There should not be any movement if we would like to transfer the movement from the muscle to the skin. Hope it is understandable. If we will go to the other part of the body where we don't have the skin muscle, we can see that the skin is connected to the deep fascia through this quite big layer of collagenous fibers, and there is quite lots of space, that like a loose connective tissue, which is full of water, ground substance, which is water, proteoglycans, which they have. There is the hyaluronan, that is the lubricating medium which allows the movement. You can understand when you look at these two pictures that your move, the skin slack, will be different in different parts of the body. Here, with the skin, you will be pulling the deeply located skin muscle, and here, this layer of the loose connective tissue will allow slightly longer skin slack, so bigger movement between those layers. If we come back here, so we have skin muscle, and underneath the skin muscle, between superficial fascia and the deep fascia, which is represented here on this picture by the yellow tunic covering the abdominal wall, we have again this quite, I don't want to say thick, but large amount of the loose connective tissue, which once again is very similar like here. It is ground substance, water, proteoglycans, hyaluronan, and that is that mobile layer which allows the movements and the gliding of the skin muscle over the deep fascia. If we will look at other picture, we see the areas which are covered by the skin muscle, cutaneous trunci or cutaneous omobrachialis. It covers the shoulder blade and arm, as well as thorax and abdomen. In those places, when you will perform ET moves, some ET procedures, surely if you will be performing opening or closing saddle area, in the cranial part, you will have underneath your fingers this layer of skin muscle. Or if you will be doing the girth procedure or intercostals or abdominal procedures, you will have skin superficial fascia because skin muscle is enclosed in the superficial fascia. So you will have skin, superficial fascia, muscle, and then underneath you will have the loose connective tissue. So in these areas, the move will be slightly different. You will be pulling the skin muscle with you as well, because that will be gliding on the loose connective tissue underneath. Moves in the other parts of the body will have different feeling because you will have only the skin, superficial fascia, and then the loose connective tissue separating layers. So it will have really different feel. On this picture, we will sort of sums it up. We have a skin, here we have the skin muscle, and you can see that between them, there is not, between these two structures, there is not as much of the loose connective tissue, but you can see it here. Underneath the skin muscle. So this is the vehicle which allows the skin muscle glide over the deep parts of the body. If we will go into the pectoral area where there is not skin muscle, we have skin, superficial fascia, and then we will have the layer of loose connective tissue separating that from the deep fascia, which is more connected with the muscles or to the muscles. I spoke about superficial fascia almost every single presentation what I ever had. So I don't want to repeat my words. And I recently saw wording from John Sharkey on his Facebook when he was promoting his dissection classes. And when I read it, I said, well, that's perfect. He sums it up perfectly. So I stolen it, and I hope that you don't mind, and hopefully John will not mind. The superficial fascia represents uncharted ground for new exciting research and scientific discovery. Not merely as a passive layer of tissue, superficial fascia plays a crucial role in pain modulation, sensory perception, structural support, movement coordination, metabolic functions, and immune responses. Recognizing its significance can lead to a better understanding of pain mechanism, improved therapeutic approaches, and enhance overall health and well-being. And here it is in bold lettering. Due to the continuity with deeper fascial lamina, superficial fascia can have a cascading impact affecting deeper ascending or descending tissues, muscles, and organs. This continuity highlights the importance of maintaining a healthy superficial fascial system to ensure optimal functioning of the entire body. Superficial fascia plays an active role in various metabolic and immune processes. Superficial fascia acts as a gliding surface, eradicating frictions, thus allowing muscles and other structures to move freely in a frictionless way. When the fascia when the fascial planes are compromised or become restricted due to the injury, inflammation, adhesion, or poor posture, it can lead to pain, limited mobility, and dysfunction. I think that I don't need to add anything else. So you understand the importance of the superficial fascia and importance of the first step of your move, the skin slide. Pulling the skin, because with that you pulling the superficial fascia. You stretch it, you mobilize it, you improving circulation, blood and lymphatic circulation, you improving function of proprioceptions, and so on. On this picture, I remove the cutaneous muscle, which was enclosed into the superficial fascia, and you can sort of see still its shadows, I would say, when I cut it off. But you see that the superficial fascia would continue on the rest of the body, on the neck, hindquarter, and belly and front limb, and so on. In this picture, I would like to remind you, and I documented that many times when I was showing you when you do move on this part, that you can see movement far away from your move. So please don't ever think that your ET move is a local move. Through the skin connecting to the superficial fascia, connecting to the deep fascia that connects to the muscles, you are affecting or having effect on the whole body. So every and each move is very important. And this picture almost takes us to the picture what we see on the cheat card, that we can start to see some muscles of locomotion. But one more bad news. In fat animals, we have to account also the fat layer, unfortunately. In some animals, this layer is so thick and covers the whole body this would be the space underneath the skin muscle. It is basically the layer which is the most mobile layer, the layer which is supposed to allow the gliding, because there was so much water and proteoglycans and spaces that the layers could glide. And this is the reality. All those spaces between fibers, you will see it on the next picture, are basically jam-packed with the fat globules. So the fat body will feel hard, firm, it will not move, you will not be able to move those layers. So you will have very limited communication. You will not know where the bones are, you will not feel any muscle grooves, you will not feel any muscles, of course, so you will not have very much the feedback. So you will need to work with your experiences and sort of imaginations, but you can still try to speak to the body, of course. You know, ET is two-way highway. You get information from the body and you also are communicating with the body, sort of informing the structures that something is going on there. Well, when I work with fat horses, I am trying to change a little bit the language, because I find out that our normal language doesn't work. The normal language, it means normal performing, or performing the normal ET move as you would do on every other horse. With fat animals, I have a couple of tips. I really reduce my pressure. More you pushing in, I know that it's tempting because you would like to feel something, so you try to push in. So I find out that more I push in, more resistance I can meet. So I take my pressure off. And then I really play with each part of the move. Sometimes the skin slack has to be done slowly and sort of gradually try to stretch the skin. Sometimes I use my whole palm, sort of like I would like to warm up the place, sort of warm up the adipose tissue and make it move better. Sometimes the bump is slow when I am waiting for the invitation. So when I applying pressure, I am like thinking, please, please reorganize yourself, you fat, and let me go in. So I take it easy and slowly, gradually apply the pressure. And then with the final part of the move, with the glide, once again, sometimes I hold the glide a little bit longer. You will see. So from maybe today, if you will see some fat horse, which by the way, I read that in UK, up to 60% of sport horses are on the edge of obesity. So I bet you will have lots of animals to exercise your new fields. So play with your moves and try to feel what is the best way to communicate with this body. So we are on now on level number 3 or 4 if we have fat animal. And I have this picture here to just remind you that this would be a picture of the loose connective tissue or the superficial fascia. And we have here individual collagen fibers. And the space between them, those individual chambers, would be normally filled with the proteoglycans, hyaluronan, minerals, waters, different chemicals. So in fat animal, all these cells, all those spaces would be filled, jam-packed with the fat, with the adipose globules. And you can understand that the tissue, which is designed beautifully for movement, is just now stiff, rigid, and cannot move very much. So this picture is quite nice to see it. On this picture, we are getting onto the level of the muscles. Muscles are covered by deep fascia, and one of those is, for example, thoracolumbar fascia. We have a couple of muscles always inserting into the fascia. So you see, right now, you can work with the muscles, but Before that, before you are on the level that you can approach grooves or you can approach individual muscles, you have to go through the skin, superficial fascia, fat, deep fascia. And you know that we were giving our moves nicknames because it was always very hard to describe the move with just names of muscles that you go over, because as many muscles are crossing over, they lying over top of each other. So it's very hard to pick up which muscles we are addressing. So we have nicknames, and we start with move number 1, lower energy blocks. You working over paraspinal muscles. But if you look at the picture, maybe you say, well, it's looking that this is the muscle that sort of continues from the hind quarter. And you're absolutely right. We have tubercocci here, and we know that our lower stops are just in line with the cranial edge of the tubercocci, where we would perform the medial move. Yes, you are working over gluteus medius, but I will try to explain the situation here. This is another angle that you can see that the gluteus medius really reaches from the uh, hindquarter area onto the back. This part of the gluteus medius we usually call a gluteal tongue, and it is very firmly connected to the longissimus dorsi. The longissimus dorsi almost creates little dish or bowl for the fibers of the gluteus medius. Between these two muscles is we don't see any loose connective tissue. There is no movement allowed. Actually, the fibers of the gluteus medius are biting into the fascia of longissimus dorsi, creating one complete functional chain of the muscles. Underneath the gluteus medius, we have longissimus dorsi, and yes, you are working on paraspinal muscles. So this is the truth of move number 1. Let's see move number 2, and then we will repeat exactly the same in number 6, butt shot. I place the arrow here, crossing the buttock. We're performing the move from the top of the hip bone to the top of the sit bone. Underneath the fascia, we would have many muscles. Hopefully on this picture, we can see some. First muscle that we are crossing is our known gluteus medius. Here the gluteus medius is covered by superficial gluteal muscle. That is the contour, or here are the contours of the superficial glute. After superficial glute, we have biceps femoris. And after the biceps femoris, we have semitendinosus. So another hamstring. So when you perform the move, you are crossing gluteus medius, superficial glute, biceps, semitendinosus. And if you are finishing the move sort of around the corner here, you will be always catching the last hamstring, which is semimembranosus. This is young foal, and we can see tensor fascia latae is below the hip bone, so you are not getting that muscle when you're performing a butt shot. But here we can see it, gluteus medius, gluteus superficialis, biceps. I use photographs of quarter horse stallion with chest, and we can see those muscles absolutely beautifully. Gluteus medius. Here we have arm from the gluteus superficialis, biceps, semitendinosus, semitendinosus and semimembranosus. Beautiful gluteus medius, superficialis, biceps, semitendinosus, and I think on this picture behind semitendinosus you can sort of feel the semimembranosus muscle. So with one line crossing the buttock, you are addressing the largest muscles of the body and the largest muscles of the hindquarter. Number 3, caudal move over the lateral hamstrings, bladder 39. When we put certain spot there like bladder 39, it tells us that we have to be pretty accurate because bladder 39 has certain position. It is located at the end of the groove between biceps and semitendinosus. And what line it is. We are just now familiar with the muscles on the groove, but you can see when we go down, here are a couple of more muscles that make everything a little bit more complicated. So let's see how we can unwind that. Again, with chess helps us to understand that the line which is the most visible, sometimes it's called a poverty line, is running between biceps and semitendinosus on the top part of the thigh. But when we go into the lower part of the body, you see it here, it changes. It runs between the middle and the caudal part of the biceps. This sausage, that is what confuses us the most. It is this caudal part of the biceps femoris. When I will click back, we have poverty line more visibly here, and this sausage here is the caudal belly of biceps femoris, or line between biceps and semitendinosus is this one. So on this line we will be looking for the bladder 39, which is on the end of the groove. We chose that bladder 39 because we were working with acupuncturists, and for them it was sort of diagnostic point for hock issues, hind limb arthritis, for example. If I will go into this picture, maybe I will have a couple of tips how to really know which line you should look at. Biceps femoris is lateral hamstring, and majority of the muscle will go to the outside. This little piece, which is not actually even visible, it's maybe palpable, is the little tendon which will be part of the Achilles tendon attaching to the point of the hook. But most of the muscle, including this sausage, will go to the lateral side. Semitendinosus belongs to the medial hamstring, and most of the muscle will go onto the inside. Once again, there will be a little tendon which is not visible that will be part of the Achilles tendon. We will come back to our brownie. We will look at the line between biceps and semitendinosus. I am not confused with the sausage, and I'm following this line. Lateral hamstring, medial hamstring, here is bladder 39 on the end of the groove. This is the confusing horse. Continuing down, this sausage is lateral hamstring. We are here, and on the end of that groove we have bladder 39. Now we have a mid-thigh point. We call it a meeting point. Looking at the viscous, you have the idea why we call it meeting point. We have a couple of muscles really meeting here. Tensor fasciae, latae, superficial gluteal muscle, and biceps. And that is the point that we will perform, or number 4. If we look at the anatomy, these two pictures, they are in different stages when I removed some superficial muscles. Don't want to confuse you. First superficial muscle would be tensor fasciae latae, and you can see that that muscle comes to this point, the caudal edge. Superficial gluteal muscle is coming exactly to the same spot as well. And then we have the biceps, those muscles we saw on viscous. When I removed the tensor fasciae lata, we can see the deeper muscles. And we see that there would be also connecting the quadriceps. And if I will go even deeper, now here we see the connection between the tensor fasciae and the biceps. You can even see the fascial connection there. It is exactly the meeting spot. And this is the deep part. Superficial gluteal muscle. You see how the fascia covering that muscle in the depth just blends with the fascia of the quadriceps. So this was the meeting point when we saw on the surface, and this is, you see how that muscle which dives into the depths, the fascia covering that just continues deeper. And sometimes we have trouble to find out the meeting point. Sometimes, and that is the horse that I really struggled, so I did photograph because I could not read the thigh. I was really curious, what is this line? I could not figure out any line which goes from here to there. And then one day I dissected horse and it made a lot of sense. We see that some of the superficial fibers from the tensor fasciae lata continues, they do not dive in to get attachments onto the bone, onto the femur, but continue and blend with the fascia covering the biceps. So when the horse does a retraction of the hind limb, we see these fibers stretched and popping up as lines underneath the skin. So sometimes you maybe struggle with the meeting point and maybe you are working on one of those horses. I have to say, I dissected about 2 or 3 horses with this thighs, so this variation is not as rare. Now we have number 5, the dreading popping the cup, pop the cup. It is a little bit difficult to find it because on standing horse, the kneecap, the patella, is hidden underneath this bulge, which is quadriceps. You can see it a little bit here, but not yet the fully when the leg is loaded. This muscle would really just be bulging over the bone. So that is so confusing where you actually doing the move. But we know we are doing the move over and around of the top edge of the kneecap. This is kneecap. So we have to find the top edge and then we can perform the move from outside to inside. I know the picture shows the arrow forward, and this is maybe the first confusing spot. It is very hard to place arrow which goes inwards onto the paper. We made the picture here when Jock is doing the move on sort of more cranially looking stifle. So you see that the move is really going inwards towards the midline of the body. On the next pictures, I will try to explain how you can find the top part of the kneecap. I think that this picture, before removing tensor fasciae lata, a little bit represents the picture when the horse is standing. We have dip there and little bulge. I usually starting from the dip. I put my thumb there and you see here is the bone. This is what you see. This is what's sticking up here. This is the bone. When you start at the dip, then with movement upwards, you would find the top edge of the kneecap. You start from the dip, you push the skin up, and you find out the top of the kneecap. If I click back, once again, you start from here, you find the top of the kneecap, push skin up, find the top of the edge, and from here you will perform, or here in this spot, you will perform the move. Skin out, apply pressure, and move inwards with the pressure. I hope that from today you will really not have trouble with the popping the kneecap. This is the last move. Of course, we have number 6, the butt shots. We already covered that. we will move on to the four quota. First move is upper blocker, working over trapezius muscle. Withers, behind the withers, we have the edge of the trapezius, the thoracic part of the trapezius. Before you can see the trapezius, I have to remove the skin, superficial fascia with the skin muscle, and if you have horses that the skin muscle is covering the trapezius, you will have sometimes trouble to feel the trapezius properly. After removing the skin muscle, we have a little bit of the superficial fascia or deep fascia and then deep fascia. And underneath that, we would have a rhomboid muscle. All these three variants are possible, what you can feel. Sometimes you feel the edges of or you cannot feel the trapezius because we have there the cutaneous. Sometimes you cannot feel the edges of trapezius because there is the thicker fascia. And sometimes you can feel through the trapezius a rhomboid muscle. Next picture would hopefully explain. The trapezius muscle is very thin, especially in its cranial portion. So even if you feel the trapezius muscle here, when you start to do the inchworm, just above the shoulder blade, the cartilage of the shoulder blade, you will be here on the trapezius, the thoracic part can be felt. But from about here, when the trapezius, the first layer is thin, you can start to feel those fibers of the rhomboid. Many times you will feel very tight bands and trigger points in them. When you come about here, we would say stop there, change your body position, because you feel this muscle, you feel the cervical rhomboid. It is so distinct muscle. You will start from the bottom edge, pull skin up, apply pressure, and you perform the move downwards over the rhomboid muscle. Yeah. So this would be your inchworm or caterpillar. You see, the muscles are usually flat, but the rhomboid muscle always stands up. It has really this curved shape that you can feel. Maybe on this picture, I will explain where is the rhomboid muscle, nuchal ligament, and crest. Sometimes you are confused. You have first crest when we go from the top, then we have nuchal ligament, and underneath is the rhomboid. I understand on this picture that you say, well, how I can be confused. Sometimes the rhomboid can be smaller or too tight that almost feels like a really ligament. If you will go around the shoulder blade, you will be way off from the nuchal ligament, and what you feel is the rhomboid cervical part. After the caterpillar, we have girth lift and triceps. Girth lift is performed behind the front limb, just behind the elbow, and we see that we would be on two pectoral muscles. First is the superficial muscle, which is pectoralis transversus, and it covers the deeply located deep pectoral or ascending pectoral. When you do girth lift, you pull skin down, you apply pressure, and then when you're lifting up, you usually feel this step. This is higher than here because this is extra muscle covering this muscle. So you feel this part. And if you have enough loose skin, sometimes you do long move that you can end up even somewhere here. If you end up higher in these areas, you can feel like strings. There are attachments of the cutaneous muscle, and also there are quite lots of nerves and vessels, and the horse reacts to it. It sort of shakes or ripples. So that would be that area. Girth lift, pull skin down, apply pressure. You feel one bump, maybe second bump and some ripple, some going over some tendons here. Number 5, lower triceps, just above the elbow. We just say sometimes 2 fingers. On both pictures, you see elbow, elbow, and that beautiful wide, distinct tendon of the long head of the triceps. When you pull skin behind the muscle, you can usually hook your thumbs there, and when you perform the move, you have distinct twang, distinct vibration, because you are on the tendon. So if it feels firm move, it's okay. You are not on the belly, you are on the tendon. Finishing 4-quarter, let's go on to the neck. We already saw rhomboid muscle for the number 1, but I will come back with another horses, so maybe we will have different pictures. Here is the neck after removed skin, covered still in superficial fascia. We have very thin cervical trapezius. This is what I was talking about, that we have really just very thin layer of muscle tissue here. When you're performing the caterpillar, if we will go back to the 4-quarter, here you would feel the rhomboid. For the neck, we will go maybe 3 fingers forward to perform exactly the same move. Pull skin up, apply pressure, move down. We are 3 fingers from our previous move, and we see once again how beautifully curved the rhomboid is. When we go on the top of the neck, move number 2, it says you perform medial move over insertion of the rectus capitis muscle. Rectus capitis is very deep move. When we perform the move here, we will be first, obviously, skin, superficial fascia, deep fascia, and then, as you see here, we have some muscles which are sending to the skull only aponeurosis, flat tendons. It would be brachiocephalic, splenius. This tendon, what you see, is from very, very deeply located muscle. As strange, but it is covered by at least 3 aponeuroses of more superficially located muscles. All muscles of interest are here. This is a splenius, which belly finishes somewhere here. We can see the muscle here. This is splenius, and I reflected that, so we see the fleshy part finishing here, and then the aponeurosis attaching to the skull here. And underneath, we have fleshy muscle, which is called semispinalis capitis. And the semispinalis capitis has this tendon, and that is the tendon that we're working over. We're performing the medial move over it. And now where the rectus capitis comes to it. The rectus capitis would be a little bit more medially and maybe slightly deeper, but in many horses, it has like 2 bellies which are connected to the semispinalis capitis. So that is where the original confusion came. Never mind, we're working on this tendon, and what is important to know, that it is attaching tendon of this muscle, which is very deep muscle, actually reaching to the first 8 thoracic vertebrae. So it is the muscle which is between, or underneath the front limb, and it is the last muscle on the neck. Underneath we have only nuchal ligament. How cool is that? That if you perform the move correctly, you can send the vibrations through this tendon to the deeper parts of the neck and at the base of the neck, and actually underneath the front limb. This is your top of the neck performance move. And now the middle of the neck, which is again rhomboid. On this picture, you see that the rhomboid from the shoulder blade is thicker, and then it thins, and sort of disappears because it attaches from about C2, from the nuchal ligament at the level of the second cervical vertebra. In the middle of the neck, it means between this and this, we should perform the move and we should get this end of the rhomboid muscle. Sometimes the muscle is sort of thin here, or it is covered more by the splenius muscle, and we cannot feel it. So it's okay to go a little bit down until you feel it to perform the move correctly. You can see even on this picture, the jock is slightly lower to perform the move. So you know you are on the rhomboid muscle. On this picture, I wanted to show you that if the muscle has its own fascia, deep fascial cover, and if that fascia would be tight, as you can see here, that muscle can be really sort of flat. When I remove the fascia, look at that, the muscle popped up even more. Maybe even that could be the reason that sometimes you don't feel the muscle, that it is so tight there that you really do not feel it. I will go back to one more picture. Just something came to my mind and I think that it's quite okay to see it. You can see in this horse the thick crest. We mentioned that there is a crest, nuchal ligament, and here is the rhomboid muscle. That is the reason why we bend the top of the neck to find this groove which separates the rhomboid from the nuchal ligament and the crest. Just came to my mind that it is so important as well to be able to locate the rhomboid muscle. Bend it in crest and then insert your fingers when you see the groove. And now I use the pictures of our other horse that you can see the rhomboid muscle quite nicely, how it goes and how it goes forward and is getting thinner and thinner. We finished the neck and we have one more procedure to go. We will be doing saddle area. We know that we are performing first the upper and lower energy blocks. We already covered those. And now we will need to perform moves over the bladder meridian. Excuse me. I borrowed a picture again from Mr. Google. And we can see that the bladder meridian starts on the inner corner of the eye, then above the ear, will go and continues on the side of the crest. And in about shoulder blade area, it splits and we have first and second bladder meridian. Both then connect on the back part of the thigh and will finish on the lateral part of the hoof at the coronet. Where are the meridians? Well, first bladder meridian runs about 3 zones lateral from the midline, and the second runs parallel to the first one about 3 zones laterally from it. Here is the picture what the measurement is. This is where our measurement, 4 fingers or a small whole hand from the midline would help us to find the first meridian, and then 4 fingers or the small hand from the first one we would find the second meridian, and then we would perform the opening moves over those 2 meridians between the lower and upper blockers. On the course, we also teach you the second way how to find the meridian, and it is to go from the rib cage, so it means with hands running upwards over the thorax, to find a little groove. Jock always said a ridge, a shelf. And here it is on the picture. If you're running your hands over the thorax, you would find this groove. You would find a groove between longissimus and iliocostalis. And other picture will show you that honestly, that iliocostalis is like a shelf. So this is where usually the second bladder meridian runs. And you can find it by palpating the groove. Remember, the superficial fascia goes over the midline onto the other side. And once again, in one of my previous lectures, I showed you that it is basically continuous sheet, continuous tissue. So when you're opening, try to look if you are able to pull the skin from the other side, if you see the movement of the skin over the midline. And same if you're closing the meridians and pulling the skin up with your glide. Look if you are mobilizing, if you can move the skin over the loose connective tissue, over, sliding over the deep fascia. And you should see movement if everything is okay, from the abdomen. When you perform moves here or move here, you can see how this area is moving as well. So that is the information what you are getting from the body while you're performing the move. So this is why you need to use the peripheral vision to see what is moving and what is stuck, what doesn't move, what looks a little bit funny. So yeah, that is the two-way highway. You listen, you watch, observe, you feel what is going on inside the soft tissue and inside the body, and the same time you talk through your ET move. If I go back to that picture, we do saddle area on energy pathways, on meridians. On this picture, you can see how much or how many layers of the soft tissue you also address with your moves. We have skin, we have cutaneous trunci enclosed in superficial fascia. We have, here in the cranial part, you will be crossing trapezius. Underneath, you have latissimus dorsi and its aponeurosis covering all this area. Underneath, we have dorsal serrate attaching to the deep layer of the thoracolumbar fascia, once again covering all this area. And then we have our longissimus dorsi. In the front, we can be touching spinalis. And then we have iliocostalis that we addressing with the moves over the second bladder meridian. Here you have proof again that when you perform simple ET moves, you can really affect so much of the horse's body that not one single move it should be wasted. Every single move should be performed as best as you can, because you never know what that one simple move will affect. And I think that with our last moves, number 16th and 17th, we covered our basic body balance. I hope that this little anatomy trip through the body will help you to visualize the structures of the body, will help you to see through your fingers those muscles, individual fibers, muscle grooves, edges, that you will be able to do the move correctly. Sometimes a little bit changing your direction is what is needed. Sometimes maybe go slightly deeper is what needs to be done. And I hope that this little presentation will allow you to master your ET technique. Thank you for being with me and enjoy the rest of the conference. I hope that I will join you later. And yeah, thank you for taking your time. Goodbye.